6 advantages of counseling for mental health. You have the opportunity to discuss social, emotional, or behavioral issues that are worrying you or interfering with your everyday activities when you seek psychological or personal mental health counseling. There are numerous justifications for seeking out psychological or personal counseling. Some of the most typical issues for which people seek assistance are difficulty focusing or finishing academic or work tasks, issues in the family or relationships. Procrastination is one example of a habit that is self-defeating. Grief and loss-related issues, issues in managing stress, overcoming horrific experiences, violence against women or sexual assault, depression or lack of drive, severe anxiety or panic attacks, issues with managing medications, angry issues, sexual anxiety, obsessive actions. Hi and welcome to Mind Stretcher. My name is Matt, and I am a correctional officer in the U.S. Army with a passion for helping others improve their mental health and well-being. On this channel, I cover a wide range of topics related to psychology and mental health, from the importance of self-care to the benefits of mindfulness and meditation. I offer practical tips and advice for improving your mental health in your everyday life. Join me as we learn more about the fascinating world of psychology and mental health. 1. Individual versus group therapy. Individual treatment, often known as psychotherapy, involves the patient and the therapist working together. You can make healthy lifestyle adjustments and learn the underlying causes of your thoughts and actions with the assistance of a qualified therapist. If you have depression, bipolar disorder, or another significant mental health condition that needs to be treated on its own, individual counseling can greatly benefit you. Being a member of individual and group therapy might be beneficial for certain people. Individual counseling is typically chosen over group therapy. A group of 5 to 15 people participates in therapy sessions with one or more therapists. You are more likely to be challenged and supported by your peers in the group during group therapy. You can put your troubles into perspective with the aid of group therapy. Regularly listening to others enables you to communicate openly about your problems and to understand that you are not the only one experiencing difficulties. You can pick up new techniques for dealing with your own problems by watching how the other group therapy participants handle their problems and create improvements in their lives. Numerous organizations are created to target specific issues like obesity, chronic pain, or melancholy. Others, however, are concentrated on social skill development. 2. Cognitive behavioral therapy (CBT). In its simplest form, cognitive behavioral therapy (CBT) examines the discrepancies between what you desire to do and what you actually do. Nobody wants their behavior to deteriorate. A short-term, goal-oriented therapy with a practical approach to problem solving. CBT is very effective. It is applied to many different problems. The patient's behavior and thought processes are highlighted in cognitive behavioral therapy. With the help of this technique, the patient starts to comprehend how their unfavorable attitudes and thoughts impact their actions. The aim is to alter the thought or behavior patterns that contributed to the patient's issues, in order to address their emotional issues. This is done by focusing on the patient's thoughts, images, beliefs, and attitudes, as well as the connections that have led them to act in particular ways. Once you have established the link between your issues, actions, and thoughts, you may start to acquire coping mechanisms both during and after treatment. 3. Family therapy. Family therapy is a psychological treatment that assists members of the family in improving communication and resolving disputes. As family members attempt to comprehend the experiences of one another, relationships are evaluated. Family therapy aims to open up relationships and promote closeness if the participants wish to. Here are some elements of family therapy that are crucial. Engagement. Family engagement interventions are frequently carried out in the course of the initial phase of therapy. Reframing relationships entails interventions intended to help people go from describing a problem in their own unique ways to coming up with solutions based on connections and understanding. Behavior modification. By giving the family members new skills and supporting personal behavioral changes, the aim is to change their behavior. Restructuring. The objective is to modify fundamental values and family norms as well as the way the family system is directed. 4. Dialectical behavioral therapy (DBT). DBT was initially created as a treatment for borderline personality disorder (BPD). Following that, studies revealed that it is successful in treating bipolar disorder, depression, SUD, bulimia, and binge eating. Another type of cognitive behavioral therapy is DBT, which was first used to treat BPD. Extreme, powerful, unpleasant feelings that are challenging to control frequently surface during interactions with other individuals, especially intimate relationships. In people with BPD, DBT often entails both DBT skills groups and individual counseling sessions with your counselor. Your therapist encourages you to use DBT techniques in your daily life and discusses any issues that may occur while undergoing treatment. DBT skills to try out. The members of the skills group discuss their stories, practice and acquire DBT skills, and support one another. Patients acquire the abilities needed to control their emotions and lessen interpersonal conflict. 4 areas are where skills are developed, enhancing the patient's capacity to be in the now through mindfulness. Distress tolerance helps the patient become more tolerant of uncomfortable emotions rather than encouraging them to flee. Emotional regulation is the art of controlling strong emotions that are getting in the way. Learning methods that help the patient interact with others in an assertive way while maintaining their self-respect. 5. Contingency management therapy (CM). You gain advantageous incentives in this behavioral therapy strategy. Patients who demonstrate favorable behavioral improvements are reinforced or rewarded. CM is based on fundamental behavioral analysis concepts. Behavior that is rewarded soon after it occurs will occur more frequently. Both commonplace and clinical settings employ contingency management. For the treatment of behavioral disorders, it is quite successful. CM treatments can be utilized in psychiatric care to promote attendance at mental health treatment sessions and boost abstinence in people with dual disorders. 6. Motivational interviewing. A counseling technique called motivational interviewing can assist you in resolving competing emotions and insecurities so that you can find the drive to alter your behavior. It is a quick process that acknowledges how challenging it is to transform your life. It is frequently employed in the treatment of behavioral disorders as well as the control of physical health issues like heart disease, diabetes, and asthma. You can alter the behavior that keeps you from making good decisions with the use of motivational interviewing. According to research, the strategy is effective with people who are initially unprepared or uninterested to make adjustments. The interviewer's job is to encourage the patient to discuss their need for change and their motivations for wanting change while maintaining a supportive approach, and to start a discussion about commitment and transformation. It is a 1 or 2 session therapy that is short-term in nature, though it can be used with longer-term treatments. Thanks for watching. We hope you found this video helpful in understanding more about psychology and mental health. Remember, it's always important to take care of your mental health and seek support if you need it. If you enjoyed this video, don't forget to like, comment, and subscribe to our channel for more content on psychology and mental health. Take care and have a great day.